Good afternoon. Welcome to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Senator Wynn. Senator Stone. Senator Titus. Chair Donate.
And I'm here. All members are present. Welcome everyone to today's Senate Committee on HHS. We have just one agenda item, which is to do the work session, and so we'll proceed to there, and then we'll go to public comment, and then we should be done for today. It'll be pretty quick. For future planning, as you may know, we may have bills that come through from the Assembly and they might come to our committee, so we don't know if we will meet next week, so it just really depends. But as of right now, because of the committee passage deadline, this is what we have so far, and as things arise, we will meet as appropriate. So we'll go ahead and open up, we'll proceed to the work session. So we have several bills. I'm going to go through each of them. We had a request to do a consent motion for all of them, so we'll do them all at the same time. If there's any questions or discussions, we can do that as appropriate. But I'm going to read the bills and who the floor is, what the motion is for all of them, of course, and then who will be the assigned floor statement, and then I will then turn it over to my vice chair to make the motion for consent on all of them as written on the work session. So we'll start with AB 100. So this one on the work session document. How about let's do this. We'll start with AB 100. I'll go through each of the bills, say who the work session document, who the floor statement is being assigned to, and then we'll have Ms. Cooper just go over what the bill does and if there's any amendments. So let's start with AB 100. This one is due pass. The floor assignment is for Vice Chair Wynn. Ms. Cooper, can you please describe what the bill?
Destiny Cooper, Policy Analyst, LCB, Research Division. Assembly Bill 100 was heard on the 4th. It requires the Department of Health and Human Services during the 2023-2024 interim to develop evidence-based and culturally sensitive assessments to be administered by the department to family caregivers, amongst other provisions. Thank you.
Thank you so much. Are there any questions? No? AB 132, this one's amend due pass. The floor assignment will be for Senator Lang. Ms. Cooper, can you please proceed?
Destiny Cooper for the record. Joanna Jacobs proposed an amendment, so I won't go over the original bill language. It will pilot a regional opioid task force primarily focused on identifying opportunities to prevent opioid poisoning, hosted by the county and funded in part with a portion of Clark County's opioid settlement dollars. The intent will be to have a broad committee staffed with public health, social service, law enforcement, prevention coalition, harm reduction, education, and others to identify gaps and trends in our community. Thank you.
Thank you so much. Any questions on this bill? Let's move on to the next one, AB 154. This one's, the floor assignment for that one is Senator Lang. AB 154, this one's due pass. The floor assignment for this one is Senator Wynn. Ms. Cooper?
Destiny Cooper for the record. Assembly Bill 154 requires the Division of Public and Behavioral Health of the Department of Health and Human Services to publish on an internet website a list of entities that accept living donations of birth tissue in a hospital or birthing center. Such entities must show proof of accreditation by the American Association of Tissue Banks to be placed and remain on such a list. Thank you.
Thank you so much. And once again, that one was just a floor assignment to Senator Wynn. Let's move to AB 169. This one's amend due pass, and the floor assignment is for Senator Titus. Ms. Cooper?
Destiny Cooper for the record. 169 requires each package or box containing feminine hygiene products that is manufactured on or after January 1st, 2025 for sale or distribution in Nevada to have a label listing all product ingredients in order of weight using standardized nomenclature with certain exceptions. Thank you.
Thank you so much. Let's move on to, unless if there's any questions, Assembly Bill 188. This one is amend due pass, and the floor assignment is for Senator John Darrell Loop. Ms. Cooper?
Destiny Cooper for the record. Assembly Bill 188 allows a physician to prescribe or recommend and a manufacturer to provide or make available an investigational drug, biological product, or device to a patient diagnosed with a life-threatening or severely debilitating disease or condition. I would like to note on the record that there are amendments adding co-sponsors, and there's also an amendment attached. Thank you.
Thank you, Ms. Cooper. Any questions on this one? Let's move on to Assembly Bill 202. This one's an amend to pass, and I will take the floor statement. Ms. Cooper?
Destiny Cooper for the record. Assembly Bill 202 authorizes a patient in a skilled nursing facility or the patient's representative to request installation and use of an electronic communication device in the patient's living quarters if certain conditions are met. There are amendments proposed. One modifies the language surrounding the notification of the use of the communication devices in the room of the patient, and an additional form prescribed by the facility in the language preferred by the patient. Please see attached.
Thank you so much. Any questions? All right, let's move on to Assembly Bill 267. This one's amend to pass, and the floor statement is to myself. Ms. Cooper?
Assembly Bill 267 requires the State Board of Health to adopt regulations to require a medical facility for the dependent, and certain other facilities to conduct training relating specifically to cultural competency for certain persons providing care to patients or residents of a facility. There were certain amendments proposed by Senator Doniate that add the attached language. Thank you.
Thank you so much. Any questions? And last but not least, SCR 5. This one's amend to pass, and the floor statement is for Senator Lang. Ms. Cooper?
Senate Concurrent Resolution 5 states the members of the 82nd Legislative Session are to urge state agencies to expand comprehensive cardiovascular screening programs to allow further earlier identification of patients at risk for cardiovascular events. There were amendments proposed by Senator Doniate and for the Nevada Legislature to direct the Joint Interim Standing Committee on Health and Human Services to conduct a study during the 2023-2024 interim concerning cardiovascular screening programs that are currently operating in the state and ways for state agencies to collaborate with federal agencies and private organizations in the evaluation and expansion of such programs. Please see attached.
Thank you so much. Any questions? Let's move on to the motion. Vice Chair Nguyen.
I'd so move to, I guess, amend and do pass on some of these and just do pass on others on AB 100, AB 132, AB 154, AB 169, AB 188, AB 202, AB 267, and SCR 5.
Thank you so much. We have that long motion from Vice Chair Nguyen and then second from Senator Titus. Any discussion or questions? Moving on to the vote as a whole. All those in favor, please say aye. Aye. Any opposition? Motion's carried, and the bills have now been all voted on together, and they have the appropriate floor statements. And that concludes our work session. Let's move on to public comment. Is there anyone in public comment that would like to come forward? Seeing none here or in Las Vegas, is there anyone virtually? BPS. I think I see someone in Las Vegas for public comment.
Hello. My name's Peggy Stevenson, and I was here to support AB 202. I just want to say thank you. This is so important. I'm not really sure what all the next steps are because I don't usually come to these sessions, but I just hope that this gets passed sooner rather than later. I'm in the throes of trying to hold Pacifica Green Valley accountable. They already have a lawsuit against them for wrongful death, and you don't know what you don't know until you know it. And so I had cameras in their room from January and have all sorts of evidence of wrongdoings and ill treatment and so on, and that they're condoning. And anyways, I'm trying to get something done, and I just really want this to go through really fast. My mother's getting out of there, but had I known these things before I had cameras, she never would have been there. So it's really, really important, and thank you, and please do it quickly. Get the governor to sign it quickly, please. Sorry, I'm so emotional, but this is like a very personal subject, and I'm sure it's personal for a lot of people that have loved ones and need extra help. And trust the glossy brochures and promises that they send you. There's no puppy dog tails in any of it, and it's a crime. So thanks. That's what I want to say.
Thank you so much, ma'am, and we appreciate you for joining us. If you would like, you can connect with our committee staff, and we can provide any level of constituent services if there's anything that we can do. And seeing that the bill has passed, it will continue on in its pathway. So thank you so much for joining us. Is there anyone else?
How long will it take?
It will proceed now to the floor of the Senate, and then it would move on through its process. So it is now out of our committee. So, well, it'll probably be within the next week. So we appreciate you for joining us.
That it will be passed and signed into law? It takes about another week?
It is pending, ma'am. But we would appreciate if you can connect with committee staff, and then we can help you if there's anything that we can do. But thank you so much for joining us. Is there anyone else in Las Vegas? I don't see anyone else. BPS, is there anyone virtually?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes the meeting for today, and we thank everyone for joining, and the meeting's adjourned.